So February is American Heart Month, a time when we all should put more focus on our cardiovascular health. I'm happy to welcome Dr. Ali, a cardiologist at Midwest Cardiovascular Institute at Edward Elmhurst Health, to the program to talk about simple lifestyle changes that have a big impact on our health. So my first question is, heart disease is so common. Is this something that you can prevent, or is it inevitable for certain people?
I think we can't, at this point, have a vaccine for heart disease. Actually, it's the plaque, the atherosclerosis. I think that's the goal in time. Right now, the aim is to try to find it early enough and try to slow the process. Try to put it off as best we can, as long as possible. The thing I feel like is the most important is to try to find it early, detect it, and find the right people that we should be treating.
And what are some things that you can do to detect it early?
So I think seeing a primary care physician, or if you have a strong family history or a strong history of heart disease in your family, maybe a cardiologist. Usually we use lab tests, talking to people, getting a history. There are heart scans out there. It's not for everybody. Right now at Edward Elmhurst, we're doing it for 40 or older, but as a cardiologist, I get it to order it for people younger than 40 that I feel are high risk. But I think seeing a physician, talking to them, I think is the first step.
What would indicate that someone's at high risk? I know when I get my blood pressure taken, that to me would be a first sign that something's going on. Is that accurate, or is there something beyond that?
I think that's one of the things. Also looking at lab work, if you've been told that you have high cholesterol, family history, or actually currently smoking, if you have history of diabetes, all these are factors. We're actually learning that just your nationality, if you have a South Asian ancestry, that actually gives you a point for a high risk. But I think family history, I think, is a very important factor. And I think those are the people that should be seeing their physicians earlier.
When you look at family history, is it important to look at lifestyle choices of your family? Meaning, let's say your father had a heart attack, but might have had diabetes or drank. Is that more of an indicator that the lifestyle had a bigger play to that, or is it the fact that he still had a heart attack, I should get checked out?
I think, first of all, if he had a heart attack and if they were less than 55, I think that's a red flag for me. Females less than 65. But I feel like some people can be doing everything right, diet, exercise, but they still have that. So then there's something more to it. I think there's a genetic condition. We're learning there's an entity called familial hypercholesterolemia. Their bodies are just not able to kind of take the cholesterol and work with it like usual. Initially, when I started as a cardiologist, we were thinking it's 1 in 500, but I think it's actually 1 in 200 people that actually have familial hypercholesterolemia. Looking at history, but even lab tests, we can find out the people that might not be homozygous, where they have both genes, but even a milder case, those are the people that we need to worry about.
Got it. That makes sense. So let's shift to lifestyle habits and choices. One of which that I constantly think about is weight, is maintaining your weight, and then I think about smoking or alcohol, the things you should or shouldn't be doing. Can you touch on that for a bit?
No, I think all these factors, weight, smoking, they affect heart disease in a way of inflammation. So I think every factor causes our body to be more hyper acute in an inflammatory state. We're learning, we can take care of the blood flow with aspirin. We could take care of cholesterol and plaque with the cholesterol-lowering medications, and there's many that are out there now. We have injectable medications, people that can't tolerate oral medicines. But I think the unknown, and I think this is kind of where the future is inflammation. But right now we know diet and exercise, staying away from smoking, these type of things will help us to decrease the inflammation in our body.
That makes a ton of sense to me, and obviously stress causes inflammation.
Absolutely, and I think there's another part where it constricts our vessels. So it makes every part of our body, and especially the heart, if the vessels are smaller, you don't get enough good blood flow. Any part of our body, the heart is a muscle, if it has to work harder over time, and if you're stressed throughout the day and for multiple days and for years, that will take a toll. So I think, like anything, it's finding it early, because it's hard to treat after the fact when the damage has been done. So it's trying to take care of these things, stress, weight, smoking, anything that we can control early on so that we can prevent the damage.
Got it. That makes a lot of sense. Well, thank you so much for being here. I can keep talking about this all day, but I think these are some great tips.
Oh, absolutely. Thank you so much.